Hi, welcome to my presentation. My name is Eva Maria Mansisidor. I work for Scandinavian Realheart as an executive assistant, which means that I do all sorts of things, but one of the things that I'm responsible for is the IP at the company. Well, I mainly do administration of IP, but I also make sure to report and advise to the CPO and the Chief Innovation Officer, for example. My educational background is in molecular biology and immunology, but I also have a master's in business creation and entrepreneurship, which focused a lot on IP and controlling innovation. So I did my master thesis at Realheart, focusing on the IP in the total artificial heart industry. And I assume that you've already had a sort of introduction to intellectual property and a background, and you sort of know what it's about, and hopefully what I talk about won't be, jumping too far from that, but I also hope that I'm not repeating anything that you've already heard. But I will talk a little bit briefly about the patenting or the application process and the international registration system. I won't go into detail into the different jurisdictions, but I will give you some guidelines on how to sort of what you can do on your own, what kind of research you should do before choosing where to file a patent and how to do it and so on. And then I will go into the characteristic of this industry and the IP landscape, and mainly the patent landscape, of course. I will go into why I will focus more on patents in later slides, but this is just to give you an overview of what I will talk about. So you're working now with this hackathon, and you have a bunch of ideas, and maybe you will come up with an idea or an invention that you want to patent, and then you're like, oh, I want to do it in all of these countries, country A, B, C, D, E. And then you have different options. You can either, do an application for each of those countries, like a national application, like you would go straight from here to here. Oh, wait, I don't know if you can see my pointer. Now you can. Okay, so you go straight to national application, but there's something called the PCT application, which PCT stands for Patent Cooperation Treaty, and it's basically an international agreement with over 150 countries. And the benefits of that is that you only do one single application in one language, and then you get one priority date that is valid in all the member states. Then you get one novelty review and preliminary patentability assessment during the international phase, and then you complete your application in the countries where you want protection in the national phase. And then when you enter national phase, you can, if you have several European countries where you want to patent, then you can go via the European Patent Convention, or European Patent Office, and that's sort of the same concept as as the PCT patent application. It's like a legal framework for granting of European patents, but it's not a unitary right. So you then get, depending on what countries you choose to move forward with after that. So there are about 40 countries assigned to that. Then you get independently, nationally enforceable patents in those different countries. But again, it's one single application in one language, and then you choose which countries you want to move forward with. So those are the benefits, and again, you cannot, of course, go directly to the National Patent Office, but there's definitely a benefit of only having to do one application. There will soon be a unitary European patent, and I will go into that more later, or in the next slide. So as I mentioned, for the PCT, there are 156 contracting states. And from my understanding, you are from either one of these countries. So your country is then a contracting state of the PCT. And when it comes to the EPC, the European Patent Office, then the European countries here are members. Now, I added Great Britain because Great Britain is part of it, but not UK. And I'm not very sure, but my understanding is the difference is Northern Ireland. Don't be mad at me if I'm wrong about that, but yeah, that's good to know. And there are, as I said, 39 contracting states. Now, the unitary patent application will be a possibility, or a unitary patent will be a possibility once the Unified Patent Court Agreement has come into force, and that is expected to happen during late 2022. And we are in late 2022, so it can happen anytime now. And what that means is basically that 25 of the EU member states that have agreed to this agreement, when you have this patent granted, then you automatically have patent protection in those 25 countries. So it's one application, one patent, and it's valid in 25 European countries. As opposed to the way it is now, you have one application, but then you designate the countries where you want protection in, and then you get independent patents. So those are the differences. So that's, if you want to know exactly what countries those are, you can go to this link here at Wikipedia, and it shows you like the color with the color scheme, or what countries are members and so on. Now, when it comes to deciding what countries to file for a patent, or apply for a patent, you should think about market opportunities and challenges. So I have here listed some things to think about and giving you some examples. So first of all, you should think about your citizenship or your residency, and what are you allowed to do as a citizen or resident in the country that you are in or from, and also what are you allowed to do as an inventor. For example, if you're a New Zealand resident and you want to file for a patent abroad, from like in another country than New Zealand, then you must first obtain a foreign filing permit. And if you have made an invention in the US and you want to apply for a patent, then you must first seek permission from the USPTO, the United States Patent Office, before being able to file outside of the US. So these are just examples, of course. I haven't looked into every country. I'm not going to list every country here and the rules and everything, but just so that you know that there are things to look out for. And in the country in which you wish to file a patent in, you should think about, what are the criteria, for example, for the patent, copyright, trademark, and what does the process look like. So for example, in Egypt, you cannot get a patent for diagnostic, therapeutic, or surgical methods for human and animals. And I think that's very relevant as we're talking about total artificial hearts here. So potentially you cannot patent a total artificial heart in Egypt. Now, you might not even want to do that because, is that a great market for total artificial heart? I don't know. I don't think so. I don't know. Something to explore maybe, but United States is the biggest market right now for total artificial heart, but you might also think, okay, what's going to be big in the future? You have to think a little bit. You have to sort of think of the different aspects. But another thing is, some countries have something called provisional applications, like the US has that, and that basically means that you file for a provisional application, and then you have 12 months where you can basically continue to develop that innovation, and then you have to file, after 12 months, you have to file an actual patent application. And the benefits of doing that is that you get an earlier priority date. And that's something to keep in mind if you like want to publish something, for example, because if you publish something, you cannot patent it. So if you're planning to patent something, keep it confidential. But if you're like, oh, I have to talk about parts of this in this conference, then maybe do a provisional patent application before that. In the countries where you can do that, then you cannot do that in all countries. And then also think about, okay, so maybe you're like, okay, but with my citizenship or my residency and with this criteria, I have green light to patent in this country. Okay, but what's the culture like? Because, for example, China, they're well known for business environment with risks. They're known for stealing IP and not respecting IP laws, but this is something that the Chinese government are working on improving, and they're also incentivizing their citizens to file for patent. Now, if you're not a Chinese company, then it can be difficult to enforce your rights there. But again, this is something that's is changing, is my perception of it, but something to keep in mind. And also, for example, Egypt has lengthy registration process and lack of adequate protection of IPRs. So, you should do your research on these three things, I think, before like choosing what countries should you file a patent. But again, start with like market opportunity and challenges, and then see like, okay, can we do this? Is it a good idea? So, the total artificial heart industry. I've listed here a few things that I see as things that characterizes this industry. And first of all, it's a very long history. The first total artificial heart was implanted in 1969. And as you can see, these are all companies that have tried or have succeeded. We know that not many have succeeded yet to enter market or continue to be on the market, or even in development. So even though there's a long history, there's quite a few players at the moment. So it's a small industry, and if you compare it to ventricular assist devices, then there are a lot more players, and many of them have been acquired by big medtech. And with big medtech, I mean like Abbott, Medtronic. Although we did see that Abiomed, who had a total artificial heart, they were previously called Abiocor. Now, Abiomed, they were acquired by Johnson & Johnson. But other than them, we haven't seen any total artificial heart companies really being acquired by a larger company. And if you are acquired by a larger company, I mean, of course, they have larger capabilities or economical capabilities. They have more economic resources. But because most total artificial heart companies are smaller and they have limited resources, then they also depend on suppliers because they cannot afford to maybe develop their own batteries or their own materials or their own valves and so on. And so a lot of the sort of accessory technology is provided by suppliers, and that also makes the industry very dependent on how those technologies are evolving and what innovations are being done there. And then, of course, it's very multidisciplinary. I mean, we have mechanical engineers and other type of engineers, different kind of scientists and experts and doctors and clinicians. I mean, obviously you need to understand the mechanics of the heart of the device, but you also need to have fundamental understanding of the body's physiology and so on. So all of these things go hand in hand, and you can't really have one without the other, which I think is something that's very characteristic of this industry. And then the last point I made here is just to again sort of explain why the focus is most on patents. I mean, yeah, I think in any technology industry, you will have a very big emphasis on the patent, because it's innovation, it's technology, right? But branding is very important, and trademark goes into branding, for example. But in the case of the total artificial heart industry, you know, you're branding and you're marketing to whoever's going to buy the product. And in this case, it's the clinicians, it's the hospitals that's going to buy the product. And how do you sell that to them? Well, you have to have scientific data supporting the safety of the device, supporting that it will improve the quality of life. And that is something that you do, in this case, through research dissemination, you know, conferences or publishing papers and so on. And in that setting, it's not so important, you know, what logo you have or what name or brand or trademark. Those things are, of course, important, but not in the same sense that it might be in, you know, selling a sneaker, for example. So of course there are trademarks in this industry, but I don't think it's really interesting to talk about that or analyze that. Same thing goes with copyright. I mean, yes, there's software code and so on, but that's not published, so it's really hard to actually analyze that. So that's why I focus mainly on patents. I think that's most interesting in this case, and most interesting for you as well. So with this slide, I want to talk about sort of the start to end. So or the whole kind of value chain of the total artificial heart industry. So you start with like an idea, you do research, you do development, and you kind of loop it around here. You do research and development, and then occasionally you test. You start testing things, a prototype, and then you go back to research and development, and it loops around here, and eventually you have enough proof of concept, you have enough data to support the safety of your device, and eventually you get regulatory approval, and then you go into marketing and sales. And throughout the whole process here, whole chain of events, knowledge is created and exchanged. I would say mainly between the developer and the universities, but also clinics and suppliers and services. And intellectual assets are created throughout the whole process here. And, you know, you can strategically protect those intellectual assets and capitalize on those through intellectual property rights. And I think that, you know, Vertonomy, for example, Vertonomy is one of the sponsors. I think they're a great example of like a virtual product. So it's not just, you know, about the physical end product of the total artificial heart, but there's so much that can be done here as well. And I think the Vertonomy is a great example of that, of like providing a virtual service or virtual product that creates synergy in the whole industry, because it helps in this process, and there's really like a win-win situation. And I think that it's important to keep in mind to be creative and have an open mind to think outside the box of what can be done through IPRs, to really like help this industry go even further. So I just wanted to show that quickly. And then, oh, I see now that I didn't change. You can ignore this. It's not the most recent 25 years, because I believe it says 1995 here, right? So yeah, since 1995 to 2021, you can see that the number of PCT applications has gradually increased. And we're moving away from, or becoming more and more a knowledge economy rather than an industrial economy. And so society is becoming more and more aware, or putting more and more emphasis on IPRs and patents, especially because they understand the importance of protecting those intellectual assets. And so we can see this trend increasing. And then again, as I mentioned, that China is really now trying to file for more patents. And these are the top 10 countries that apply for PCT. So we have China followed by US. And yeah, I think it's interesting that we see this gradual increase. I mean, it's expected, but it's very interesting when you compare it then to this next slide, where we look at the total artificial heart filing, and we see that it doesn't follow the same curve here, or the same increase here. I don't know what happened in 2007, but someone filed a lot of patents for some reason. They didn't get granted though. But yes, there's an increase. There are more application happening on this side than on this side, but again, it's not like a gradual increase. And I think that's interesting, an interesting observation, that it's not really fast moving in that sense when it comes to innovation. But again, it's not so surprising given that it's a small industry and the limitation of resources. And if you compare it again to someone like Medtronic or Abbott, I mean, they can just file for patents just for the sake of filing patent. But if you're a smaller company, it becomes very expensive you have to be very strategic with how you do it. You cannot just go and file or acquire patents left and right. So it does make sense, but there are a lot of opportunities for more to be done. And if you look at the geographical landscape of the patents, then you can see that there's more intensity in the US, for example, and it's not so strange because the US is the biggest market for total artificial hearts. We also see the up-and-coming markets like China or India. They have a large population, so it makes sense that people are also thinking about them. And with the figure to the right here, I just took a few of the total artificial heart companies and searched, and the top 5 came up here in the top 10 jurisdictions. And you can see that Carmat, they have a very large and broad protection, for example, compared to maybe Syncardia. Maybe they're, a little bit more modest in that sense. Okay, so if we go back to the total artificial heart itself, then I think there are 2 important questions that you can ask yourselves. And so don't be scared by this weird figure. I will explain it. But so what technologies constitute a total artificial heart, and what technologies are patented? So here I have done a so-called tech tree that I did for my thesis. So this is an old one, but it's just to give you an example. And I'm sure that this can be done differently. I'm sure that you can do it much better than I did it. But the idea behind it is that you break down the technology in hierarchical structure, sort of like a parent-child relationship. And as you see, for example, one part is our power supply, and then the power supply can be broken down into source, and source can be broken down into battery or drive line, etc. Or you have valve. A valve can have different designs, can have different materials. And what I like about this technique of using the technology tree is that you get a sort of an overview of the whole technology and what is needed for developing a total artificial heart, and then you can place yourself, like, what are we focusing on? What is our core thing here, and is it occupied by others? Are others doing the same thing, or are we unique here? And then you can also, you see these little dots here, they're called I have mapped out the IPC, the patent intensity by IPC code. And an IPC code is basically something that patent offices use to classify patent applications by like category. And these are old because I did this a few years ago, so they've been updated, but this is just an example. So for example, if you look here, it's very intense on this code is F04D, continuous flow pumps. So again, it's just an example of how you can structure it up, like map out the technology, then you can position yourself and position what others have done and the intensity and where there's maybe an opportunity. Here maybe, for example, or where, and you can also see, like, if you're here, you can see what have others done here. Okay, hopefully you get the point. And then if we go to the next slide, then the third question is what technologies are not yet patented, because there's an opportunity, or maybe there's just, we don't know why they have not been patented. But what I concluded in my master thesis was that there were three main categories that I found like a gap on the landscape. So we have power supply, and battery technology in terms of size, efficiency, weight, longevity, etc., etc. And then transcutaneous energy transfer, which is basically a wireless energy transfer, so that you don't have to have cables going through the skin from the heart through the patient's skin, because we know that infection rates are high and that leads to complications, of course. So if we could solve this, then you would take total artificial heart to the next level. And we have some companies that have used TET, but for some reason not everyone is using it. So it's an interesting thing, like why isn't it being adopted more? Digitalization and artificial intelligence, I think we cannot close our eyes to that, because it's becoming increasingly important in general in medtech, and I think that total artificial heart companies need to start adapting that to be part of that, and we didn't really see that on the patent landscape. And then biocompatibility, of course, the artificial heart must be compatible with the body. So if you think about materials, then you probably know that some materials might be rejected by the body and some are more accepted, and you can also have coatings and so on. And what was interesting was that there was a paper that came out this year called The Ongoing Quest for the First Total Artificial Heart as Destination Therapy. I recommend you all to read this article. It's very interesting, by Visit Al. And they also mentioned technological advances and future perspectives. And what they said was more or less confirming my findings, that more powerful and compact batteries and transcutaneous energy transfer technology is sought after. And also biocompatibility and innovation around materials. So there needs to be more done here. We need more innovation around these areas. And here on this slide, I know this figure is very boring, but I just wanted to show you an example of, if you search for these IPC codes, these are updated ones, the new ones. Here is the description of them, and here is how many hits you get, both dead or alive patents. But as you can see, if you look at, for example, total artificial heart, you only get 26 hits. Implantable batteries, 24 hits. Valves, 14. So it's not, and this one is, I just put in certain assignees, just show you these are absolutely not all. We have also, Oregon Heart and Cleveland Clinic and so on, but it's just an example. You get 39 hits. So it's not a very super crowded landscape, which is a good thing for you guys. And when it comes to the IPC codes, you can look at WIPO's World International Patent Organization's website. I have a link here for you. And go and look there and see. These are just examples, but go and look what IPC codes are out there and sort of see if what you're developing or what you're looking into or what you want to patent, if you find it in a category, then you can just search for that IPC code that's that can help you find sort of what's out there and how crowded is it and what are people doing in that field. And then if you, I don't know if through your university, if you have access to patent databases, but otherwise Google has a free one that I recommend. It's absolutely not the best one out there by any means, but it's free and it works. So it's this one. And I encourage you to use it. And again, I just wanted with this slide to show you sort of these are the official technological fields that is sort of the same as the IPC code. It's like a categorization that's given to the patent application, and you can see that obviously medical technology is no surprise that that one is the highest. Engine, pumps, and turbines, I mean, it's not pumps, I mean, it's not so weird, but again, you know, you don't really see, I don't know, well, we have surface coating here a little bit, but there are, I think, more to be done here. You know, think a little bit about what I said before, where there's a gap. We don't really see those things here. So, except for coding, maybe that goes into materials, but or biocompatibility. But you get my point, I think. And then the last one again is just again another way of showing the landscape of what's out there. These are keywords that you get when you do a search. So for total artificial hearts in general, these are the keywords that pop up. And again, you can sort of see this and see if, you know, what you had in mind or what you're thinking about or what you're envisioning or what you want to patent. Does it seem like there are other people doing that, or where is there maybe something missing, for example? But yeah, again, I just wanted to give you a little bit of an overview of what the landscape looks like. And yeah, okay, so thank you for listening. I hope that this was informative for you and that you learned something. If you have any questions, do not hesitate to contact me. You can email me. You have my email address here. You can contact me on LinkedIn. Or wherever you want. I hope I can answer your questions if you have any. And again, thank you so much for listening and good luck to all of you. Thank you and goodbye.